Hello everyone, my name is Sunny and today I'll be presenting my student honours research that was conducted at the University of South Australia. But before I get into the specifics of my research, let me give you all a situation to picture. Imagine losing all sense of mobility in your lower half of the body. Imagine having to have a carer take care of you 24/7 because you physically can't go to the toilet on your own. Quite a scary analogy, right? But unfortunately, this isn't just an analogy. But rather, it's a real-life situation where approximately more than 15,000 Australians are currently experiencing. This is traumatic spinal cord injury. Traumatic spinal cord injury, which will be referred to as SCI from now on, is a debilitating neurological condition which imposes substantial physical, psychological, and economic implications on patients and their families. But what's worse? Treatment outcomes and injury prognosis is hard to predict in those suffering from SCI, and researchers believe this is due to the lack of diagnostic tests that provides an accurate prognosis. But what if I told you I have a method that could potentially change that uncertainty to certainty? Today, I present our research in a new imaging modality that has the potential to accurately prognosticate SCI using fluorine-labeled GE-180 PET-CT. SCI consists of two phases, the primary and the secondary. The primary phase is characterized by the initial trauma induced onto the spinal cord, and the secondary phase comprises of further delayed responses within the tissue component, specifically neuroinflammation. And my research focused on this specific response. During neuroinflammation, the activation of neural tissues upregulate overall expression of what's called the 18-kda Translocator protein, also known as TSPO. TSPO is a transport protein that is highly expressed in cells composing the central nervous system, and we wanted to target that exact protein. To target TSPO, we used the novel GE-180 tracer. Previous studies done by Tremoletta and his research team show that there was an increased tracer activity in the spinal cord of rat models with SCI in contrast to those without. Doig and his research team have recently explored this further, displaying a significant correlation between GE-180 expression and neurological function in clinically relevant rat models of SCI. This provided the foundation of my research. So our aim was to determine whether altered expression of TSPO was associated with the uptake of GE-180 in human participants with SCI. And we hypothesized an increased expression of GE-180 will correlate with injury severity. To achieve our aim, we employed the prospective cohort research design. Initially, eligibility of approximately 720 participants were assessed using pre-developed eligibility criteria shown in this slide. Here, 75 were deemed eligible, and of the 75, 17 participants were enrolled into this research. From the 17 participants, only 4 were scanned. Of the 4 selected male participants, participant 1 had an injury duration of 43 months, being our only chronic subject. Participants 2, 3, and 4 each had a duration of 8, 13, and 23 months respectively, making them subchronic participants. The International Standards for Neurological Classification of Spinal Cord Injury, also known as the INSCI assessment, was utilized to accurately gauge the severity of the injury. Those assessed with participants were then classified into American Spinal Cord Injury Association impairment scores, also known as ASIA scores. Here, participants 1 and 2 had ASIA scores of A, which was considered most severe, and participants 3 and 4 had scores of C and D respectively. Prior to the PET-CT scans, T1 and T2 weighted MRI along with diffusion weighted MRI were performed on participants to provide anatomical assessment of the spinal cord. On the day of the GE-180 PET-CT scan, participants were placed in uptake rooms where a cannula was inserted for tracer injection. Then participants were intravenously injected with approximately 226 megabecquerels of tracer in a bolus form. After an uptake of 60 minutes, participants were then transferred to the scanner bed for the actual scan. The scan composed of two components. For the first component, PET-CT was acquired at the level of a CI lesion at one bed position. For the second component, the entire spinal cord was scanned from L2 to the vertex in a continuous bed motion. The acquired PET-CT images were then later analyzed using the PMOD software. Volume of interest regions, referred to as VOIs, were drawn around the injury site at one vertebral size and three vertebral sizes with the SCI in the center as shown in Figure 6. Also, VOIs of the base of the brainstem at the C2 level, the aorta, cardiac tissue, liver, vertebral body, and L1 spinal cord were also generated as reference regions for data quantification and comparison. From these regions, three types of standardized uptake values, referred to as SUVs, were derived: the maximum SUV, average SUV, and the total SUV value of the selected region. The brainstem was utilized as a pseudo-reference region for comparison with the injury site. Whilst this was also due to the brainstem's similar anatomical properties to the spinal cord, the known limitations of GE-180 displaying generalized decreased tracer uptake in nervous tissues compared to other organ tissues made quantitative analysis interpretable. Comparisons between these two regions were achieved by deriving the ratios between the SUV averages of the injury site and the brainstem. Validity was ensured by comparing our results to the INSCI score and a previous study investigating the uses of GE-180 in multiple sclerosis patients. Reliability was assured by keeping the dimensions of the VOIs consistent between each participant to eliminate any extraneous variables. Here are the scans that was acquired for all 4 participants. As many of you would notice, in the 60 to 90 minute PET-CT scan, a collective decreased uptake of tracer is actually displayed at the injury site compared to the surrounding reference regions such as the liver, shown in Figure 8 and 9. Hence, this was why the use of quantitative analysis using SUVs was necessary for this research. So when referring to the SUVs of the participants, an association between GE-180 uptake and injury severity could be observed. Here, participant 1 with the ASIA score of A displayed the highest tracer uptake with an SUV average of 0.775. In contrast, participant 4 with an ASIA score of D displayed the lowest tracer uptake, SUV average of 0.388. This indicated that where there was greater TSPO expression, there was an increased tracer uptake. When comparing the SUV ratio of the injury site between the participants, participants 1 and 2 displayed the greatest GE-180 activity of 1.85 and 1.56 respectively. In contrast, participant 4 recorded the lowest SUV ratio of 0.808 at the injury site. With these values, we derived a correlation graph. This graph displayed that there was a strong and significant correlation of 0.93 between the GE-180 tracer expression and neurological severity represented by the ASIA impairment score. When compared to the previous research studying GE-180 uptake in multiple sclerosis patients, the mean SUV average of multiple sclerosis participants was 0.69, which is comparable to the SUV average of our research participants of 0.59. This ensured the validity of our research methods and ultimately indicated the sensitivity of GE-180 PET-CT imaging when detecting neuroinflammation in SCI patients. The biggest limitation of this study was the factors affecting reliability. As addressed previously, to ensure reliability, the methodology of this research required the dimensions of all VOIs to be kept consistent. However, if we think about the physiology of each participant, the sizes of the spinal cord will not be the same over all participants. As a good example, the spinal cord of participant 4 in our research was actually pencil cord shaped. This meant that the spinal cord was significantly thinner than the rest of the participants, and hence the VOI region was quantitating neural tissues other than the spinal cord. So, for future research, conducting measures for reproducibility, such as pixel shift experiment, will aid in determining the dependence of specific placement of the VOI. There were also limitations to the study cohort of this research. This was as no participants with acute SCIs were actually studied. To elaborate, this specific group was not included in our research cohort as majority of these participants were quite unstable due to their condition. Hence, it was deemed not ideal to recruit acute participants when using the methodology for the first time on human participants with SCI. Hence, for future research involving acute participants, we recommend conducting the scan in facilities where stabilization of the injury is ensured. This pilot study demonstrated the correlation between TSPO protein expression and GE-180 tracer in SCI patients for the first time in the world. By doing this, the study has successfully proposed a new insight to the implication of GE-180 PET-CT imaging within the treatment pathway of SCI patients in clinical settings. Therefore, providing further accurate diagnostic and prognostic information regarding SCI does not seem like a story of the far future. So that brings us to the end of this presentation, and I would like to thank you all for listening in. I would also like to thank my 3 supervisors, Ryan O'Hare-Doig, Dylan Bartholomews, and Catherine Guerrero for their amazing support, and would also like to acknowledge the Lifetime Support, who was our funding body for this research. Thank you again.